Hello, everyone. Thank you for joining us today. My name is Karen Ryan, and I am the Policy Director at LiveWell, Colorado, and the host for today's webinar. Thank you for joining us. The topic for today's webinar is Healthy Kids, Healthy Planet, and we're really trying to work to get this Safe Routes to School network and all of you thinking outside of the box about how we can improve the environment for our kids to walk and bike to school safely. Just to tell you a little bit more about the network, this webinar is brought to you by the State Network Steering Committee. LiveWell Colorado acts as the lead facilitator for the steering committee, but we are also work in conjunction with all of the organizations listed here. You can see Kaiser Permanente, Children's Hospital of Colorado, the National Safe Routes to School Partnership, Bicycle Colorado, Littleton Public Schools, CDI, and CDPHE. And it's through the hard work of these individuals and organizations that we've been able to maintain and continue the efforts of the state network post any funding from the federal government. So we're really doing all of this via volunteer effort, and want to thank all of those individuals for their hard work. The network itself is really a broad range of individuals, agencies, and organizations. We looked at the list of those of you on the phone and on your computers, and it's really a broad and diverse group of individuals that really just want to get kids walking and biking to school. And so thank you for your participation today. Now I'd like to introduce our panel. Our moderator for this webinar is Sandy Stenmark. She's the physician lead of Colorado Pediatric Cardiovascular Health for Kaiser Permanente and a member of our steering committee. And then our panelists include Mia Bemelin, the Outreach Coordinator for Dr. Cox, Natalia Swalnick, the Director of Environmental Health for the American Lung Association, and Mim Mursky, who's the Program Coordinator for Engines Off through the City and County of Denver.
Thank you, Karen. This is Sandy. I'm very excited to be part of the State Safe Routes to School Network, which brings together partners to create healthy kids and a healthy planet. Today's webinar will focus on creating a healthy environment which supports walking and biking to and from school. We will discuss the importance of reducing air pollution and promoting physical activity to improve children's health. We will focus on these strategies: how to form school pools, car, walking, and bicycle, how to site schools away from highways, how to successfully have an idling reduction campaign, and how to engage students and parents.
Sandy, sorry to interrupt, but I did want to, I forgot to mention some of the housekeeping items. First, we did want to let you know that there will be a recording of the webinar available beginning tomorrow on LiveWell Colorado's website, and I'll give you directions on how to access that at the end of the webinar. And also, if you want to submit questions throughout the webinar, please do so, and you can simply type it in the questions tab on your screen, and then we'll answer these questions at the end of the session. So sorry to interrupt, but please submit those questions throughout the session.
Great. Thank you. Kaiser Permanente is interested in healthy communities because we realize to improve population health, we have to look at strategies beyond the exam room. We're working with partners such as the Safe Routes to School to create programs, environments, and policies which help support safe transportation choices such as walking, bicycling, and public transit. We recognize to improve health, we need to focus on engineering physical activity into the daily life and also how to improving air quality. The reasons to increase physical activity are many. physical activity improves mood and cognition, which obviously both are very important for school success. Also improves fitness, bone strength, and sleep quality. Physical activity lowers one's risk of diabetes, heart disease, obesity, and certain cancers. We know in Colorado that our population isn't as active as it could be. This is the percentage of children, adolescents, and adults which meet the physical activity guideline. And these numbers are by self-report. When accelerometers are actually placed on people, the levels are much lower. So you can see that we only have basically a half of children and adults meeting the physical activity guidelines, which for adults is 60 minutes a day, and it's 30 minutes a day, and for children is 60 minutes a day, and adolescents only approximately a third. We do know that both children and adults who actively commute are more physically active and less obese. One of the reasons physical activity has declined, you can see in the following slide, where the number of children walking and biking to school has declined, where obesity rates have increased. Presently, 1/4 of Colorado children are overweight and obese, and approximately half of adults are so. In order to reduce this, we need to look at strategies such as safe, active transportation. Besides physical activity, another reason to focus on safe routes to school from a health perspective is because of the impacts on air pollution. Air pollution is very damaging to the pulmonary system. It increases your airway inflammation, which exacerbates many lung diseases. It decreases lung growth, which is really important in children, since children's lungs are continuing to grow through childhood. It decreases lung function. Like smoking, air pollution actually increases a woman's risk for preterm birth, and her child may have a lower birth rate. Air pollution increases lung cancer. It's associated with both asthma development and asthma exacerbations. Infants and children are among the most susceptible to these adverse health effects, as are chronically ill people and the elderly. In addition to the negative impacts on the pulmonary system, air pollution also damages the cardiovascular system. Pollution causes a change in gene expression, which leads to increased inflammation, injuring of the cells lining the blood vessels, narrowing of the blood vessels, and altered blood coagulation. Each one of these leads to cardiovascular disease, and you can see that the combination of the four is certainly not what one would want. Not all exhaust is the same. Diesel exhaust tends to be more damaging. It's more carcinogenic. It increases both allergic and inflammatory responses, and it also worsens asthma and allergy symptoms. When we talk about asthma, it's one of the more common chronic diseases, with 10% of children and 7% of adults being diagnosed with asthma in the U.S. Air pollution is a known trigger for these for asthma attacks, and the rate of asthma is higher in poorer communities and with children living close to a freeway. Now, when we talk about children living in a freeway, a recent study by the Journal of Environmental Planning and Management surveyed schools and students and found in the Denver-Aurora area, approximately 1/4 of schools and students were located within 400 meters of a highway. And a smaller amount, you can see, are less than 100 meters from the highway. The next slide illustrates why this is important. This is a slide from Stan Zeffler from National Jewish Hospital, who looked at asthma rates in Denver public schools. You can see both the open and the closed arrows are the most severe asthma rates. The red dots indicate 75% free and reduced lunch. So what you notice is that the arrows all tend to be lining up in a straight line, which unfortunately is I-70. So children that are in school or living near the I-70 corridor are much more impacted with asthma. One of the reasons for citing schools appropriately is certainly to cite away from the highway. And a great example of a positive regulation is the Aurora subdivision regulations, in which they state that a school needs to be located in the center of a community and on a local and collector street. So you can see that by doing that, you won't have the increased prevalence that you get being sited near a highway. Well, some of the good news about reducing childhood asthma is it can be done. The Atlanta Olympic Games study demonstrates this. During the Olympics, people worked hard in the city to decrease traffic counts, and you can see that there was a 22.5% decrease in the amount of traffic, which led to a 28% decrease in ozone and a 42% drop in childhood asthma events. So reducing traffic congestion does help improve air quality and health. So the good news is we know the benefits of reducing traffic congestion. We know walking and bicycling to school increases physical activity. Time in natural settings are increased with walking and bicycling. And turning off engines certainly improves air quality. Our panelists will now each discuss very successful programs that they have implemented which help accomplish all of the above strategies. Next to discuss is Mia Bemlin from Dr. Cog, who will discuss her successful Way to Go school pool.
Great, thank you, Sandy, and I appreciate this opportunity to talk about our program. As Sandy mentioned, my name is Mia Bemlin, and I work for the Denver Regional Council of Governments, which is also known as Dr. Cog, our acronym. We are a nonprofit association of local governments that addresses the region's challenges. We service the Denver region, which includes the following 9 counties: Adams, Arapahoe, Boulder, Broomfield, Clear Creek, Denver, Douglas, Jefferson, and Gilpin counties. The program that I work in is called Way to Go, and some of you may have known us as Ride Arrangers, but we are currently rebranding our new name to Way to Go, which accurately reflects our service offerings better than just arranging rides. And our mission is pretty simple. We are just trying to get folks to drive less, and that means by using other forms of transportation, such as using public transportation, ride sharing, biking, walking, working from home, etc. Perhaps some of you are familiar with the Bike to Work Day campaign. Well, we are the organizing body of Bike to Work Day for the Denver region. Our program started in the mid-1970s after the oil embargo and national energy crisis. And the majority of our efforts have been targeted at employers and their employees. However, my position is focused on schools, and I coordinate our highly successful school pool program, which started 20 years ago. Our school pool program helps families find others in their neighborhood to carpool, walk, bike, or ride the RTD bus together to and from school. It's a free, convenient, and secure matching system. Parents can identify what kind of pool they're interested in, such as a carpool, a walk pool, a bike pool, so forth. And the service can be used for planning part-time, full-time, or even emergency trips. There is no obligation to participate. One thing that we always touch on is liability, and we always inform families that we assume no responsibility but provide information for their use. We do not run background checks. We don't confirm valid driver's licenses, or we don't even assess insurance coverage on participants. Users are advised to screen participants to their personal satisfaction and check their own insurance coverage for carpooling to ensure they are covered under such voluntary arrangements. And one thing that we always make clear is that there are no drivers, vehicles, or insurance provided. With our school pool program, we use this really cool mapping software program, and it identifies parents' best matches based on their home and school locations. Once parents have their matches, parents contact one another to make their arrangements and discuss such things such as their schedules. They arrange pick-up and drop-off points, decide how to share costs, if any, so forth. And parents are only matched with parents from their school. However, a parent can log into their profile and change their setting to be matched with parents from other schools that are nearby. A parent can also add comments to their profile to indicate, special requests or preferences, such as, I can walk the kids to school in the morning, or my child is in after-school activities. The software program includes several different security features. One is on the map that the zoom level is restricted, so therefore you can't zoom right on top of somebody's house. And when the parent registers in the software program, they need to have their school enrollment passcode, which they can only receive from their main office. And it's set up that way to make sure only real families are accessing the information. And then the last security feature that the program offers is that parents decide how much of their personal information to share. For example, if they want to share their email address and have it displayed in their profile, they can, or they can set it up where users have to contact them through the software program. Schools participate in our free service by selecting one of two enrollment types. The first option is what I call the opt-in method, and that's basically where parents register on our website. And I would say majority of traditional public schools select this method, and it is successful when there is a critical mass of registrants. The second option is what I call the opt-out method, and that's basically where the school submits their list to us, but provides families with an opportunity to opt out, saying that they don't want their information shared. And majority of the non-traditional schools select this opt-out method because they have limited to no yellow school bus service. And when I say non-traditional schools, I'm referring to more of those charter, private, magnet programs. Our research indicates that more pools are formed when families use the opt-out method. Therefore, I always encourage schools to consider the opt-out method if it's feasible because, one, families are going to get better matches, more matches, and that means more pools are going to be formed. Secondly, I always tell the schools that their rosters are not going to be shared with anyone outside their school, and that also that happy families equal happy school administrators. Many schools publish student directories, and when they do, in my sales approach, I always push for that opt-out option because parents are so accustomed to already having their information shared in their student directory. And then schools, if they do the opt-in, they often receive a low response to the opt-in, and then the parents will call the office complaining, or they'll start utilizing that student directory. And then parents are often pleasantly surprised when they learn of others who live in their area. When a school selects the opt-out method, parents are provided a really cool personalized map of their best matches. Parents love these lists. The first page is a customized letter from the school and myself, and you'll see that it includes both of our logos to illustrate our partnership. The second page is this Google map, and it includes their home location as well as their closest matches. And then the following pages provide the contact information of their matches. These lists are either emailed or snail mailed to parents, depending if they have an email address. And what we have found is that many parents use the information for other reasons, such as play dates, summer barbecues, even finding babysitters or finding temporary transportation needs. And we like those activities because our research shows that those often lead to pool formations. When a school submits their roster to us, we can provide them with a poster-sized distribution map. And the school administrators love these maps and often display them in their main office and use it as a recruitment or as an advertising tool. They like showing it to parents who are thinking of enrolling but perhaps have transportation issues. On these maps, we can identify either 1 mile or half-mile radiuses to encourage walking and biking. The radiuses help parents gauge their distance to and from the school. We can even recommend walking and biking routes by digitizing those on the map. Just last year alone, I worked with over 70 schools and provided school pool lists to more than 13,000 families. And our research concluded that we helped form more than 3,500 school-related carpools last year, which is huge. Our school pool program is the largest in the nation, and I often receive calls from other metropolitan areas wanting to duplicate it. Just recently, San Francisco and Oregon called for guidance on their school pool programs. Our program is improving air quality and promotes physical activity to improve children's health. Our program is evaluated on the number of vehicle miles that we reduce. Therefore, our emphasis has been more on arranging carpools because those trip distances are generally longer. In the past few years, though, I've signed up more schools to help them with their efforts in forming walking school buses and bike trains. Next year, we will be updating our research, and it will be the first time we plan on asking parents about those walking and biking groups. We will find out how many walking and biking groups we helped form. Next year, I'm excited to announce that I plan on offering a third way that schools can enroll in our service. And I want to give a big shout out to Peter Hurst at Boulder Valley School District, who is the mastermind behind this great idea. And he actually piloted it with some schools this past fall. He cleverly called this the Community Network Map. And I plan on offering this to my current schools that meet this criteria. Schools that publish a student directory, that did the opt-in but received a minimal response, and that they were not willing to do the opt-out. Here's how it would work. On the directory form that parents would complete at registration, we would let parents know that if they wanted to be included in the directory, they would also be uploaded on an interactive map showing families' home locations. Their student directory would be emailed to them in the form of an Excel spreadsheet with everyone's contact information. And each family would be assigned a map code. And that map code, is identified in the directory as well as on the map. And then families would receive a link to the school's map. And then when they click on the link, a map would load and show the families with those map codes. And to use this tool, I would use this really cool software program. It's free. It's called batchgeo.com. You can plot numerous addresses at once and have them displayed on an interactive map. The map and link are not accessible to the public. A random and unguessable URL is created. The only way a search engine can find that URL is if someone were to publish that link on a website. Our school pool program is available to all public and private elementary, middle, and high schools in the Denver area. If you're interested, please give me a call. If you're outside of the DRCOG region, I wanted to point out there are some free tools that you could take advantage of. One is you could use that batchgeo.com to create your own community network map. Another one is a website that I just learned about. It's called carpoolassist.com, a free tool for schools. Although the name has the word carpool in it, it can be also used for forming walking school buses and bike trains. I spoke with a developer, and we talked about ways how that functionality can be used, and she's always looking for comments, feedback. Again, this is a free tool. It's awesome. Another free tool that I know about is called dividetheride.com. And then lastly, there are some apps out there. I've done a search and kind of played with some of them. One is called Carpool School Edition. And again, that word has carpool in it, but can also be used to help parents form walking school buses and bike trains. Some of the other apps I know about, one is called Carpooler with a K rather than a C, and another fun one is called Looptivity. And lastly, here is my contact information. I'm happy to help, so feel free to contact me. I'm very passionate about Schoolful, so please use me as a resource. And thank you so much for this opportunity to talk about Schoolful.
Thank you so much, Mia, for that great presentation. And we'll take questions at the end. The next presenters are going to discuss the Clean Air at Schools engine off. Natalia Swalnick and Mim Mirsky will now present their portion of the webinar. Thank you.
Good morning, everybody. My name is Natalia Swalnick. I'm the Director of Environmental Health at the American Lung Association in Colorado. And I'm going to give kind of a high-level overview of our program called Clean Air at Schools, Engines Off, and for the purposes of this presentation, we call it CASIO because we all tend to speak in acronyms. So I'm going to take you just on a quick ride through our program and let you know that this is something that's open to people and schools across Colorado. It's not just a metro program. It's not just a rural program. We've had success in both kinds of environments, and I'm going to explain some of the facets of our program. So this graph really shows the impetus to the development of this program, because idling is an air quality problem. And no matter how fantastic a job our programs are in order to encourage people to walk, bike, to school, etc., there's always going to be somebody who's going to be driving. And also, if there's going to be kids exercising in that environment, we want to create the best, most optimal air quality possible. So what this graph demonstrates is an air quality monitor that was placed at the top of Swansea Elementary School. And for those of you who aren't familiar, it's one of the schools that Sandra was pretty much alluding to on her map, which is on the I-70 corridor. Actually, I believe is partially under the highway. And the air quality monitor showed predictable increases in air pollution during regular rush hour commute times. But then they also discovered a blip right around 3 o'clock. And those blips were picking up increased levels of benzene and soot in the air. And what they were able to attribute this to was an increase in traffic at the time of school pickups. And they were able to demonstrate that there was a problem with unnecessary engine idling at these schools, and it presented a fantastic opportunity to improve local air quality at elementary and middle schools, because as the kids come outside, the vehicles are in park. They don't need to be on, but they are, and that's what children are breathing. So as a result, we decided that that opportunity was for us to go into schools and improve the local air quality. So at the American Lung Association, we serve as the umbrella organization for the program. We receive funding from Encana, which is a natural gas company, as well as the Colorado Department of Transportation. And we run this program in conjunction with the Department of Environmental Health at Denver, and you'll hear from them later. And as well as the Environmental Protection Agency is involved in the program as well. And what this group does is sort of serve as the advisory council to the CASIO program. So we work together to overcome challenges, to select the schools, figure out who the best candidates are, and I'll touch on that a little later in my presentation, what makes a school the right kind of school that we want to work with, as well as distribute the funding and really leverage new partnerships and help make contacts, because recruiting for schools to be a part of this program is probably one of the biggest challenges that we face. And so with the help of people on this webinar, we're hoping to kind of enhance our relationships in the community. Oh, we're just trying to advance through the slide. There we go. So this is a chart that demonstrates the results of our CASIO program, and I want to emphasize that we are measuring for reductions here. So the bigger the bar, the bigger the impact that we've had. And our results show that we've had an average of a 58% reduction in emissions at schools. So we have had, at every school that we've worked with, where we've implemented the full community-based social marketing program, and Mim will talk about some of the elements in that program in her presentation. Whenever we've implemented our full menu of options at schools, every single time we have seen a reduction in emissions in our local air quality. So looking at this graph, you can see that the lowest reduction or the smallest reduction that we've obtained is about a 25%, and the largest reduction in emissions that we've seen is about 93%. So we've been extremely effective in implementing this program, and this metric is really great because when people see this, they want this kind of result at their school. Our funders are really excited to see a measurable impact like this, and I think it makes the program look really attractive, and that we're able to, really demonstrate the impact of our program on the local air quality. So what are some of the keys to the success that we've had through CASIO? Well, we think that the partnerships across several agencies has really created the spirit of cooperation. We're able to leverage contacts. We're always looking for new partners. Just the fact that not one organization is going it alone, and we're able to divide up the program so that we're able to work geographically. So for instance, Denver Environmental Health is responsible for implementing the program within the schools in the Denver Public School District. We also work really closely. Boulder Public Schools has had several schools, and they do a great job of helping us implement the program at their schools, because my office is in the tech center, and in the spirit of the program, it does not make a lot of sense for somebody in the tech center to be driving up to Boulder Public Schools very often to be there firsthand when there's partners in the community who have a vested interest in making this succeed. We also run a voluntary program that's conducted with positive messaging. We want to make sure that people do not see this as a mandate. They do not see this as a government enforcement of a law or anything like that. We want to make sure that people know that we're asking them to do the right thing for their the health of their children and the health of their community. We often receive really great results. We also do some direct interventions with drivers, and we talk to every driver. We do not single out the drivers who are idling. We make sure that everyone is reached. Probably the most important role that anybody in the program has is that of the community champion, and that's the person that we work with at the school who really spearheads the project. Without this person, it can feel as though you might be forcing a school to undertake this program, and that's the last thing you want. You want an engaged champion. You want somebody who has a lot of questions, somebody who has ideas on how to capitalize on the menu of options that we already offer and make it work within their school, and also enhance to what we've already suggested. The community-based social marketing approach is really key. Then we'll talk about that in a minute, but really, giving out information we have seen through our own studies and through national studies. Just distributing information doesn't always have a big impact. When you make it a program that the school owns, when you change the culture of that community, that's where you see the biggest impact. And then finally, we manage pre- and post-test data studies that are statistically significant, and again, that really helps when you are showcasing the results of your program and also looking for additional funding. This is probably one of the most time-consuming elements of the program, is lining up volunteers to conduct idling observations, because we do observations at 3 different points throughout the academic year, and each of those observation periods is 4 consecutive afternoons. And each afternoon you need about 5 to 7 volunteers depending on the size of the school. So while it can definitely be a challenge to get those volunteers lined up, this results in some really significant data that has statistical relevance, and you saw the chart and the results speak for themselves, and when it's all over, those are results that we can be really proud of. So this is my contact information. Like I said, we're always looking for schools to partner with. It's not too early to recruit for upcoming school year. So if you have any questions, I definitely encourage you to email me, which is usually the best way. And we are, like I said, we're completely open. There's not one type of school that we're looking for. As long as we're able to demonstrate some of those elements that are our keys to success, those are the schools that make the best candidates for us.
Thank you so much for that presentation, Natalia. Now, Mim will give some really hands-on great ideas on how to implement a successful program.
Great. Thank you, Sandy and Natalia and the Safe Routes to Schools Network, and hello to everybody listening on the phone or on your computer. Natalia just gave you the information about Casio, which is a program that we're both proud of the success, and now I want to kind of give you more hands-on why some of the keys and tools that we use that we think make our program more successful. As you can see from the title right here, I'm going to be talking about more than just hanging signs at schools. So after you just heard Natalia talking about all the efforts that we've done over the past 5 years to reduce idling outside of Denver schools, you may be asking yourself, how big of a problem are idling vehicles? This statistic is one that we use a lot with parents because it's quite shocking that 1 minute of idling produces more carbon monoxide than smoke from 3 packs of cigarettes. Since parents already know that cigarette smoke is bad, it's great to equate the public health impact to a message that they already know. But typically when I say this to people, their first response is, but that's not a problem at our school. And as Natalia said, we rely a lot on the data, and so we like to combine the message with information about what we've observed at that particular school. So these are results from 2 of the schools that we were in Denver last year. As Natalia also said, the key to Casio's success is really that it engages the whole community. Instead of forcing a project or a program on them, we're engaging the drivers, and our aim is to change their behaviors. The next thing that I'm going to say is so important that it's the flashiest animation in my whole presentation. So this is the one thing I would like you to take away. Information alone is not successful in changing habits, and I'll give you a couple of examples. That sign right there is 12 inches by 18 inches, so it's a rather large sign, but when we go to schools to collect our idling observations, even after we've hung the signs, we notice vehicles parked directly in front of those signs idling. So we know that the sign alone is not successful. In fact, in our pilot year, we had one school that we only provided signs and brochures to, and the research told us not to expect a reduction in idling at that school. But unfortunately, we actually saw an increase in 13% of idling at that school. And so we know that the signs alone are not going to change your parents' driving behaviors. But they certainly can be a part of the program that you bring forward to your school in order to improve the driving behaviors. It's important when you have messaging to be specific to your drivers. So you can see that sign says children breathing at the top of it, because we know from talking with parents that the health message is the one that's going to be most impactful in getting them to change their behavior. We have another program that we do, a partnership with the Colorado Convention Center, where we were trying to reduce the idling of the vehicles, particularly the coach buses, as well as the tractor trailers delivering equipment and supplies for the various events that they have there. And in that case, the drivers were really concerned in having their business be well represented in the community. And so for them, we found that the message that would be most impactful to get them to change their behaviors was something about being a good neighbor. And so the messages say respect our neighbors and encourage them to turn the engine off. So we use a different tactic based on the different drivers because drivers will have different motivations for changing their behavior. It's also important to remember that everyone forgets. The school program that we do, as Natalia pointed out, is school year long. It's not one visit to the school and then we think the problem is solved. And we try to engage with the schools for as much as 6 months of the school year. As you can see, it takes 9 to 12 months to actually change habits. And so we know that we need a significant presence with the school in order to be able to see these changes in behaviors. These 5 strategies right here are what I want to talk about in the rest of my presentation, and they are the community-based social marketing tools that we use to go beyond an information-only approach and really get drivers to shift their behaviors. So now I want to kind of cover each of these individually. As Natalia pointed out, it's valuable to have data to support the effectiveness of your program. So I hire high school students and provide them with a paid internship. We go and collect observations at the schools, and you can see there's an example on the right of one of the observation sheets, which does not have any personal information on it. Sometimes we'll write Broncos bumper sticker or ski rack to help us identify the cars, but we never write down license plate numbers. We collect information before we've begun the program, and at that time we refer to our research as a transportation study. We don't even mention the word idling because we're afraid we might bias drivers' behaviors before we start, but we want an accurate picture of how bad is the problem at that particular school, and then at the end we can have an accurate picture of how successful we were at improving idling at the school. We also, when we measure the middle observations, it gives us a way to check in on how successful our campaign is going. Secondly, once you've collected that information and you're ready to launch the program, it's time to announce it to your community. We use several tools. Many schools have Friday folders where you can get messages sent home, and so we'll have a letter from the principal that includes the local example of the observations that we collected at that school. Maybe a school nurse or a parent on the PTA may make an announcement at a school event like the holiday concert, and we also hang those no idle zone signs that I mentioned. Natalia alluded to the importance of the local champion as far as making a program successful, and I was thrilled when I showed up at College View Elementary School last year to hang the signs and noticed that the principal had added the message to the bottom of their marquee. While you're communicating the information to your community, you don't only want to tell them about it in the beginning and the end. Giving periodic updates both helps them stay motivated towards reaching their goals. For example, in that chart below, you can see that in February, we could have sent a message to the community saying, congratulations, we've already cut our idling in half, and encourage them to stay on their goal. However, if the reduction wasn't as significant as you expected, it also gives you an opportunity to re-strategize if you're not reaching your targets. This next community-based social marketing tool I think is the most effective in creating behavior change. With our school program, we ask parents to sign a pledge card committing to their child that they will not idle at pickup time. They keep part of the card in their car to remind them, and they return the other part of the card to the school. As you can see, that same principal made this bulletin board to demonstrate all of the parents that had returned their cards and to show that turning the engine off at that school was a valued behavior. Making this pledge public and durable has two significant factors. First, by having the names there, the drivers are held accountable, not only to their child that they committed to not idle, but also to other parents who could potentially call them out if they see them idling and also notice that they were one of the parents who signed the pledge not to idle. The thing is that actually the fear of being called out is enough to make parents and drivers pay attention to their behavior without anyone actually having to do it. But even more importantly, the act of signing the pledge is what gets the drivers to start envisioning themselves as someone that does the new behavior, and that is the most significant thing in getting people to change their actions. As I mentioned, people will forget, and so it's important to include reminders in your campaign. Right there are two of my high school interns going and talking directly to drivers. As Natalia said, they will talk to all of the drivers, whether they are thanking the ones who aren't idling or reminding those who are about the Engines Off program at that school. The reminders are most effective when they're close in time and space to the action. So in this case, the students are right there talking to the drivers in their cars. In addition, having students a little bit older than their own students talking to parents and guardians about this behavior puts a face to the issue and helps them connect more with the reasons why they need to be concerned about creating air pollution. And finally, your reminders can specifically match your driver's needs. At one of the schools, we noticed that there was a significant Vietnamese population, but none of us spoke that language. So we had the school staff translate our messages to drivers into Vietnamese, and you can see my two students there holding the signs, displaying it, so that at least we could show these parents who could read the message and become a part of the campaign. Another thing that you can do is provide them with prompts or tools to help them overcome their forgetfulness or whatever excuses they may have for not idling. And then finally, celebrate. At the end of the year, maybe you want to have a field day to talk about how great it is that you've made the air quality better for the students. It's also important that when you're reaching milestones throughout the campaign, to celebrate them and engage the community in congratulating them for making these efforts. Green Mountain Coffee Roasters did an idle reduction policy across their fleet of 25 tractor trailers, and when they hit a milestone of 5,000 gallons of fuel that they did not have to purchase because drivers were having less wasteful driving behaviors, all of the drivers got cool t-shirts, which helped them feel like they were a part of the bigger picture goals. And so finally, just a reminder of what these 5 strategies are that will help you be successful towards reaching goals. And these can be used not just as we've used them, and I've given most of the examples here in idle reduction, but they can also be used if you're trying to shift behaviors from parents driving their kids to schools to taking more active ways of either biking or walking to school as well. So these strategies can be applied directly to safe routes to schools as well as other behavior change goals. You want to measure the conditions both during and before and during your program, so you know how successful you were. You want to communicate the issue, and using local champions and multiple means of getting the message out is great to increase your impact to the community. When you get drivers to make a commitment to, or parents to make a commitment to a new behavior, you're helping them to envision themselves as somebody that does that new behavior. Don't forget that people do forget, so make sure that you've got reminders as part of your campaign from the start. And finally, celebrate the things that you were able to do successfully. Thank you. I also, at the end of this presentation, which will be posted on the LiveWell site, like Karen said, I put some tools that might be valuable resources. The Colorado Department of Transportation has an Engines Off Colorado campaign, which is trying to make resources available statewide. And we've built the website that has sample policies and laws, as well as some strategies and tips that you can share with parents. Our Facebook page is a great way to find out what's going on in Denver. And then most importantly, those community-based social marketing tools come from this website, www.cbsm.com. And there's a free version of the book, the most recent version of the author's book online. But you can also read articles and case studies and either read the forums or post your own questions to learn what other communities throughout actually, I think the English-speaking world, because this is a Canadian website, and I know that there's also programs from elsewhere. So you can get some tips from folks and learn what other people are already doing well, or get some advice from other people on that website.
Thank you, Mim, for that wonderful discussion and the exciting program. I want to remind people to please type in their questions so we can answer them and have further discussion.
So we'll give you a few moments to type in your questions. And in the meantime, we do have one that was submitted during the presentation. And I think I'll start out and submit this question to Sandy. But if any of the other panelists have input, please chime in. And the question is, could it be argued by folks that they don't want their kids to walk or ride because of exposure to air pollution when their kids are outside, rather than seeing themselves as part of the solution?
In a word, yes. Unfortunately, it could be argued that way. And obviously certain populations are more vulnerable. The children with moderate to severe asthma or other pulmonary or cardiac diseases are much more at risk, and if it's a higher pollution day, you're much more worried. But as the submitter of the question said, the importance is getting people to see themselves as part of the solution, and I think that that's why the strategies discussed today were so critical, that there's something everybody can do. If you need to drive, then you can carpool. If you don't need to drive, then getting more people to walk or bike with the use of the way to go. Programs would really help improve air quality. And certainly anybody can turn their engines off when they arrive at the school for pickup or delivery. So I think all of these strategies are important to improve the air quality for all of our children.
This is Natalia, and I would just like to add something to that. I just wanted to point out a couple of resources that exist so that you can make that decision for yourself on days where there's poor air quality. If you are in the Denver metro area, ozoneaware.org is a website that's run by the Regional Air Quality Council, and that will tell you the ozone forecast for the next 24 hours. Or you can try airnow.gov, and you just have to decide, or the parent or the driver needs to decide, is the air quality too poor for my child to be outside on their way to school that day? But also be aware of the fact that if they're driving, they're also contributing to the problem. And one thing to be aware of is that most air quality problems do tend to spike in the afternoon. So perhaps they could be outside in the morning where the problem hasn't had a chance to get as bad, and then in the afternoon, you know, if parents aren't comfortable with them being outside, maybe that's the point where they pick them up. Because ozone, which is the one criteria air pollutant that we're out of attainment for, that forms in the hot summer afternoon when the air has a chance to be more stagnant and cook in that hot afternoon sun. And so that's why you see ozone problems worse in the afternoon. So that would be my recommendation.
I think the other thing to add is there's trade-offs to everything, and you have to weigh the benefits of being physically active, arriving to school alert with friends, having a good time on the way to school versus on a low pollution day, the problems with exposure to air quality, especially if you aren't in the more vulnerable population group.
Okay, we have a few more questions that I want to try to get through. The first is, other than the state and national Safe Routes to School programs, where can local health departments seek grant funding for programs like idle reduction, carpooling, and community walk bike to school events?
For the Engines Off program, we seek a lot of private foundation grants. So for instance, in Canada, Natural Gas has given us about $15,000 to run the program this year. The reason they wanted to do that is because they are concerned about local air quality, and you know, as a natural gas and oil producer, that you have a presence in that area, so they're looking to offset some of their emissions in a different way. And so I would suggest private foundation grants, and then also state agencies as well have been interested in funding this program.
And hi, this is Mia. And as far as the Dr. Cog, you know, our software program is free. So if you're in our area, by all means, take advantage of our services and so forth. That's what we're here for.
The other consideration is that there is, as Mia mentioned in her presentation, a number of free programs out there and applications online. And so really it's just a coordination through the school. And so these are low-cost programs that don't necessarily take a lot of resources. We have another great question that I'd like to ask our panelists, is that are there assisted carpool programs for special needs students, for example, those in wheelchairs?
You know, in all the years, this is Mia, in all the years I've been helping schools with carpool programs, I've never hit up against that one, but I would think that's absolutely doable. Just recently I've been working with Boulder County. They're working with a private school up there, and happening there is that 25% of their students have large musical instruments. So it's about, you know, in the software program, parents can add comments as far as those sort of requirements. So the software program, it can be it can work out for whatever their situation is. So if you're working with a school that has special needs, the software program, you could tweak that and put those comments in there. If it's, you know, for a wheelchair or car seats, large musical instruments, so forth.
Great. Thanks, Mia. Our last question, it looks like, is directed towards MIM. How did you find high school students to engage in Casio programs?
Thank you. And actually, that kind of tag teams back to the previous question about limited resources. The program that Denver does is we have a partnership with Denver Public Schools. We have been in at least one DPS school each year that we've done the program. And so we work with one of their charter schools to provide a professional internship where we're exposing this student to environmental science careers and environmental health careers. So in addition to the data entry, data collection, and professional speaking experiences they get some exposure to the other work in our school. Some of the other communities that also implement Casio are able to just recruit volunteers to also collect that data. And in either case, you're getting some helpful work done by people that you pay a little amount or are just there as volunteers because they care about the issue. So that's a good way to kind of maximize your resources as well.
We've had another question submitted, and it is, do the software programs mentioned, such as batchgeo.com, also allow schools to create maps of potential carpool partners for after-school events like extracurricular activities?
Absolutely. That BatchGeo website, you can use it for anything. So if you wanted to, arrange some, a football game, everybody going to the football game, you could use it for that tool, absolutely. It's a great tool, free tool. And then also the software program that Dr. Cog manages, we also have a sort of events-based tool in it. So if parents wanted to use it for example, I was working with a gymnastics club where they had 200 to 300 gymnasts, and that, like, every Saturday would go to one location, and so we used our software program for that as well. So I'm pleased to hear people are thinking about more than just school trips. Those sort of extracurricular, help me out, curricular, thank you, extracurricular trips. Great question, thanks.
Okay, well, it looks like we're at our time, and so the last question actually is just part of our information. They were asking if the presentation would be available, and yes, we will have that posted on the LiveWell website tomorrow, and all you have to do is visit livewellcolorado.org and visit the toolbox, and then select webinars in the toolbox menu. So thank you all for your time today. We'll follow up with some additional information and then the copy of the webinar, because I know there are a lot of valuable resources within the presentation itself. So thank you so much for your time, and have a great day.